In 2020, female breast cancer became the most commonly diagnosed cancer type globally. About 2.26 million women were diagnosed with breast cancer, and over 685,000 died from the disease. With timely diagnosis and appropriate treatment, breast cancer generally has a very good prognosis. However, breast cancer survival is not uniformly high around the world. There are substantial disparities in survival between more developed and less developed countries, as well as between different social groups within countries. These disparities are due in part to reduced access to early diagnosis and timely completion of treatment. WHO studies the barriers to accessing diagnosis and treatment and works with stakeholders to mitigate or eliminate these issues. IARC researchers also study the intergenerational effect of breast cancer deaths, the knock-on effect that the death of a parent or caregiver has on the bereaved family. Recent results show that the number of maternal orphans, which means children under 18 years at maternal death due to breast cancer in sub-Saharan Africa, exceed the number of deaths from breast cancer among women in the region. These results underscore the urgent need for continued action to improve breast cancer survival in this region and also in any part of the world, because women constitute one of the pillars of human society and its sustainability. Although the month of October is drawing near to its end, breast cancer awareness should stay and remain a daily social priority. In the spirit of this, I have put 4 tips you can practice. And the first one is to educate yourself. Having inaccurate information or not having any information can stand in the way of women receiving the care they require. For this reason, you must do your best to stay updated and seek out accurate information about the disease. Make sure to check multiple sources to educate yourself. Healthcare providers are your best resources to accurate and reliable information. So, if you have questions about breast cancer, they can equip you with all the essential information. The second one is to educate others. This Breast Cancer Awareness Month of October is a good opportunity you can take to start conversation about breast cancer with people around you. Send text messages or email to women you know, sharing information about the disease. Include information and accurate links to help educate them. You can also spread awareness on social media and encourage other women to speak with their healthcare provider about breast cancer. Number 3, you should know your risk. It is important to understand the difference between relative risk and personal risk for breast cancer. If you are a woman, you have a 12% relative risk, but your personal risk could be much higher. For example, if there's a history of breast cancer in your family, your personal risk will be much higher. Knowing your personal risk will help you get the assistance and care you need. And finally, number 4, you have to schedule a mammogram. If you are a woman aged 40 years and above, you should schedule a mammogram every year. The major global stakeholders recommend annual mammograms for women aged 40 years and above. Take this opportunity to schedule a mammography screening for yourself if you haven't already done one this year. Let's join hands together with all the stakeholders in the campaign for breast cancer awareness, for the protection of our women and the survival of our own human species.